gloves, but really hone in on chemical allergies. My name is Patty Taylor. I'm Vice President of Professional Education and Clinical Affairs with Ansell. I'm from the United States. I'm in the New Jersey office and came over for the conference and to work with the team here.
Sessions are commenced upstairs, and if you want to take part in a master class in here at the Trade, the master classes are about to commence. So grab the master class if you want to attend. They're about to kick off in the Trade.
All right, our CEO would like to address the group, so we had him do a video before coming over, or coming down to Australia. So I'm going to play a video from him.
Ansell, the world's largest supplier of surgical gloves, is also a world leader in providing superior health and safety protection solutions and continuing education for over 20 years. We believe that continuing education has a significant impact on the knowledge and competency of the nurse clinician, as for all healthcare providers. With the healthcare industry constantly changing, it is critically important that professionals stay current and in compliance with changes in laws and regulations, as well as with technological advances. In fact, education and understanding best practice care is a commitment to being a professional, continuously seeking to improve and staying up to date. And ultimately, it is a commitment to provide patients with the best possible care. Thank you for attending this CEU, which is sure to enhance your knowledge and professional development. Thank you.
Okay, so our learning objectives. Today we're going to define the difference between latex allergies and chemical allergies in particular. We're going to identify the incidences, the causes, and the symptoms of the various allergies, including chemical allergies. We're going to talk about the treatment for these allergies. We're going to identify strategies to reduce these allergies from occurring, and discuss how to select alternative medical device products or gloves to reduce your incidence of allergies. So appropriate selection of protective medical devices is done every day. The most widely used medical device product are medical gloves. I don't know when everyone's here started in the operating room, but I have to tell you, I started back in 1973. I know I don't look that old, but I did. I worked in the OR for 20 years, and I really enjoyed it. But when I was an OR nurse and when I circulated, I scrubbed and circulated and did everything else, I didn't wear gloves. I didn't wear gloves until the late 1980s, almost 1990, when we threw the sponges in the sponge bucket and you had to count them, you know, at least at my time we laid them on the floor and you counted them all out. You used your hands, you know, and you'd get a sponge stick or one of the other instruments and kind of spread it out to show it's one and not two, but we all did it with bare hands, and hopefully we all washed our hands after, but gloves were not widely used. When AIDS became an issue, again in about the early 1980s, that's when we started to be concerned about what was in the blood that we were touching. And it wasn't until 1988 to 1990 that we started to look at universal precautions and bloodborne pathogen precautions, and wearing of gloves became very, very common. So once we started to wear gloves more than we did in the past, we started to develop some allergies, various allergies. One was a latex allergy, and others are chemical allergies. And my learning is we all know more or less about latex allergies today. We didn't back in 1990, but we certainly do today. We still don't understand the difference between latex allergies and chemical allergies. So I'm going to talk a little bit about latex allergies, but more so on chemical allergies. So there's three types of allergies that are associated with medical gloves. The first one is type 1, IgE mediated allergic reaction. That's latex allergy. The second one is type 4, or contact dermatitis, allergic contact dermatitis. That is chemical allergy. And the third one is what we call irritant contact dermatitis. That's generally what you break down of the hands, the dry, the red, from scrubbing, winter season, just various different things, using paper towels to dry your hands. Powder from gloves sometimes cause irritant contact dermatitis. Sometimes you get it under a watch, you know, if you sweat underneath your watch and all of a sudden you have some irritation under the band. So a little bit about type 1 latex allergy. Back in 1990, 1992, that's when the various countries started to say, hey, something's going on with our gloves here. We're starting to see allergy to latex. They didn't know what was causing it though, but we do know that people were starting to develop latex allergies. 1% of the general population are allergic to latex. They were back then and they are today. 17% of healthcare workers are generally allergic to natural rubber latex. That varies. In the OR it's higher because in the OR we wear surgical gloves for a long time, particularly latex and powdered for years. The healthcare workers on the floors have a lower incidence, somewhere usually around a 10 to 12%. The other population that has a high allergy to latex is children, particularly spina bifida, because they had repeated surgeries. And I would say about 10 years ago, the incidence of latex allergy was around 50% of that population. Today has decreased to about 5% because we're no longer wearing natural rubber latex gloves when we're doing surgery on spina bifida patients. So that has decreased. Generally, the latex is triggered by a direct contact either with the skin or the mucosal membrane. What we've learned is that it's the protein in natural rubber latex that causes the allergy. There's some 250 proteins in natural rubber latex, but only 50 proteins are causing the allergy. We've also learned that if you wash your gloves better in the production line, you have an extended wash cycle at the end of the production line, that removes the proteins from the gloves and decreases the likelihood of developing a latex allergy. To be honest, I wouldn't recommend people who are allergic to latex to wear latex, but there are some studies out showing that it's pretty safe to wear latex today because the proteins are just not in the glove. They've been washed out. The symptoms vary from hives to itchiness, runny eyes, runny nose, all the way up to asthma and anaphylactic. And some patients and some healthcare workers have died of latex allergy. Here's a picture of a nurse. On your left, you can see very smiley face, very normal. On your left, my right, or on your right, you can see a nurse being exposed to powdered latex within 10 minutes. And you can see that she's starting to get the red eyes, her face is starting to swell. You can see the blotchiness in her face. That's a typical reaction from exposed to generally latex powder. A little bit about type 4. Type 4, which is a chemical allergy, certainly not life-threatening, but it is a major concern to healthcare workers. And the reason it's a major concern is most healthcare workers are allergic to the chemicals in the glove than they are to the latex. 33% of the allergies that healthcare workers experience are due to the accelerators or the chemicals in the glove, where about 17% are associated to latex allergy. It is mediated by the T-cell lymphocytes. It is a delayed reaction. I didn't mention, but latex allergy is an immediate reaction. All of a sudden the body starts to respond. But with the delayed, it can take 6 hours to 2 days before you start seeing a reaction. Generally, if it's on the glove, you'll see your hand starting to get a little red, you'll see some vesicles developing, and it may extend a little bit beyond the glove. Most of the reaction is under the glove, but it can go up to your elbow, and your forearm can get a little itchy and irritating. Here's a picture of a chemical allergy, and you can see the vesicles, the redness. That's a very severe reaction. Not everyone gets this severe. Contact dermatitis, I mentioned a little bit about it. It's not a mediated response at all. It's technically considered a non-allergenic reaction caused by frequent hand washing, maybe sweating in your gloves, the powder of the gloves, paper towels, things like that. And generally it's a dry rash. There's some images of it here. Generally it's in the webs of your fingers. It's just dry and irritating, gets cracked, and that can be serious because it opens you up for infections. So you really need to watch that. So to concentrate on chemical allergies, and the topic of this presentation was about chemical allergy masquerades. And we use that term because a lot of people just don't know they have a chemical allergy. Right away they get an irritation, a reaction, and they think it's latex. Type 4, or chemical allergies, is the second largest occupational disability. As I mentioned, it's 33%. And it brings a greater risk of bloodborne infection because, again, once you've broken that skin down, it opens it up for bacteria and viruses that you may be exposed to in the operating room. The incidence, as I mentioned, is 33% for chemical and 17% for latex allergies. And in Australia, the occupational skin disease is the second most common work-related problem. Economically, it's a cost of $33 million annually. It's a big cost to healthcare. Causes. So what causes chemical allergies? The main cause, these are all the different classifications: accelerators, stabilizers, retarders, fillers, extenders, etc. But 80% of chemical allergies are caused by the accelerator. Okay? Accelerators are used in the glove to process the glove and to cause a stronger film. So accelerators are generally necessary in the glove and have been used for years, but again, with the wash process, just like latex, you can remove a lot of the accelerators from the glove. Of the accelerators, these are the 4 main accelerators used in medical gloves. It wouldn't matter what manufacturer, most use at least one or a combination of these. Thiorams is an old accelerator used for years. It's about 60% of the allergies are caused by that. Carbamates, 30%. MBTs are about 1 to 5%, and the same with the DPGs, about 1 to 5%. So if you're selecting a glove, all you have to do is ask the manufacturer, once you know what you're allergic to, what chemicals are used in their manufacturing. All right? Even if a manufacturer tells you that they use, let's say, thiorams, but they wash all the thiorams out, not good enough. There's still thiorams in the glove. They may have reduced the concentration, but if you're allergic to thiorams, you should not use a glove that has thiorams in it. You still should select a glove without thiorams. Other things that contribute to dermatitis or to contact dermatitis, pre-existing irritant, contact dermatitis. So the more your hands are dry and irritated, that opens your skin up and that allows the chemicals to penetrate into your system and set up a chemical allergy. Other factors is the sweating under the glove and the glove powder also increases your likelihood of chemical allergies. And other things in the glove that may increase allergic reactions are things like color pigment. So some people are allergic to certain color pigments, and if you look at medical gloves, I mean, you see a lot of white, but there's also green and there's blue and there's purple and pink and all sorts of colors, and those are color pigment that's used in the manufacturing process. It's rare to be allergic to the color pigment, but it does happen, so that could be another factor. Symptoms, you can see the person scratching here in this little picture on the left. It's a redness, it's the swelling, it's the vesicles that set up, that you saw that clear liquid in the vesicles, and that really identifies that you have a chemical allergy. Some other pictures to see. It disrupts across the hand, and the front of the hand, the back of the hand. So diagnosing this, I mean, sometimes you look at it and you say, okay, is this latex or chemical? It can be confusing, but usually the physician should take a medical history, understand what other symptoms you might have besides the skin irritation. Have you had any systemic responses, runny nose, itchy eyes, etc. They'll also do a physical exam, and quite often they'll do a patch test, so that you go into the dermatologist and you have a patch test done, and he'll test you against the various accelerators and identify what accelerator you might be allergic to. Treatment, topical treatment, since it's ointments, steroids. Also, you can take oral steroids as well to reduce the effects of a chemical allergy. And it is completely curable. That'll go away. Once you stay away from the chemical that's causing that irritation, you'll return to healthy skin, and you just need to, as I mentioned, identify what glove you should be wearing to avoid that chemical. Strategies again. This is someone who's had the skin test. He's had different up to, I think it says 34 there, so he's gone into a dermatologist, and the dermatologist is testing him for 34 different chemicals that he could be allergic to determine his allergy. And again, you just need to minimize the contact with that allergy or with that agent, and good skin care. Nurses should be using hand lotion, and it should be a water-based hand lotion, not an oil-based hand lotion. Oil-based hand lotions quite often will break down the material, the gloving material, so always look for a water-based hand cream and use it regularly. I don't know, I'm terrible with that, but that's something we need to get better with and have healthy skin. Selection, I talked about taking a look at the various gloves in the market. These are the five main glove materials that are used in the market today. The first one is the latex, obviously to avoid latex allergy. If you have one or the patient has one, you need to avoid latex. If it's a chemical, just find out what chemical is in the latex glove, and you can safely wear the glove as long as that chemical is not in it. Neoprene. Neoprene is a synthetic material. We still quite often, you'll see us refer it to a rubber, because it is a rubber, but it's not a natural rubber. So sometimes that can be confusing. Quite often you'll see rubber, but synthetics are classified as rubbers. So a neoprene is no latex, and there's some neoprenes on the market today that are made with no accelerators as well. So if you want to avoid latex and accelerators altogether, for surgery, take a look at a neoprene glove. Nitrile, same with nitrile, that's mainly used for exam gloves. I'm not aware of surgical gloves made out of nitrile. It's a very good barrier. No latex in nitrile. There can be some accelerators in nitrile. There's a few on the market now without accelerators too. So you do have an option there. Polyisoprene, another synthetic material, mainly used for surgical gloves. That material is very similar to a latex material, but generally polyisoprenes have some type of accelerator. So again, it would be good for latex allergy, but you need to determine if it has an accelerator that you might be allergic to. Vinyl has no latex, and vinyl has no accelerators. So for an exam glove, it would meet that requirement. However, it's very poor in barrier. It tears very easily, personally, I'm not an avid fan of vinyl, but it is an option. It is an option. So some advances in glove technology, as I mentioned, there's a number of manufacturers now that offer accelerator-free gloves. So you can get not only a latex-free, but an accelerator-free, and then avoid all the allergy issues altogether. And those are generally in neoprene and nitrile gloves. Additional benefits of non-latex accelerator-free is, and you saw the chart, they're just as good as latex. I still believe latex is the gold standard. It's a beautiful material. Unfortunately, we can't all wear it. But the new synthetics on the market do mimic latex and pretty good. Pretty good. Good grip, good fit, very comfortable to wear. So really when you move from latex to a synthetic, you're not giving up that much in comfort and dexterity and grip. So in summary, chemical allergies to glove products are generally associated with accelerators, as I mentioned, about 80%. Chemical exposure and skin disorders are really unnecessary, and you can prevent them with good hand hygiene and staying away from the accelerator that's causing the issue. New technologies are out there, so you can avoid gloves with accelerators. And by understanding and knowledge of perioperative nurses in glove selection, we can have a safer environment, not only for us, but also for our patients. And with that, that's really the end of my presentation.